Optometrists, this video is to help you prepare for the OET Optometry speaking test. I'm going to explain how to approach a speaking role play, make the most of your preparation time, demonstrate the assessment criteria in your speaking, practice the role play, and learn from each role play you complete. Ready? Let's go. The optometry speaking test requires you to role-play two different situations with an interlocutor. You will always take the role of the optometrist in the conversation, while the interlocutor will take the role of your patient or a family member of your patient, for example their husband or wife, adult son or daughter, or the parent of a young patient. The two role-play situations will be quite different to allow you to demonstrate a range of English expressions and functions which are typical for healthcare conversations, including reassuring, explaining, persuading, and asking questions. The interlocutor, as the patient or family member, might also have an emotional response to their health condition, such as anxiety, frustration, or sadness, which are all common emotions optometrists deal with every day, and allow you to demonstrate your empathy and ability to manage the patient to make the right choices and decisions for their health. Everything that you learn while preparing for OET speaking will be immediately useful to you when starting your new healthcare role in an English-speaking environment, and give you the confidence to tackle any situation, from giving bad news to explaining the steps of a healthcare treatment. By demonstrating flexible, accurate English and responding appropriately to the interlocutor, you will demonstrate to the assessor and regulators that you have the language required for a B grade or higher. Before each role play, you have 3 minutes to prepare for the conversation using the role card. Remember that you can ask the interlocutor questions during this preparation time. If there is a word you don't know the meaning of or how to pronounce, you can ask this during the preparation time, and if the interlocutor knows the answer, they can tell you. Let's look at an optometry role play card in more detail. There are 3 sections to the card: the setting, the background information, and the list of tasks. Here are my recommendations about what you should do during your preparation time. Notice the setting of the role play. In this card, it is a private optometry clinic. This tells me that the situation is not urgent and that I may or may not have met this patient before. Look through the background information to find out some details about your patient. For example, their age and any adjectives which describe how they're feeling. Here, I can see that my patient is 75 years old. Although there isn't an adjective about how the patient is feeling, I can see that the patient's spouse has been complaining about the dangerous way he or she drives. When a patient attends an appointment because their spouse has been complaining, this can mean they feel reluctant to be there and could be resistant to your suggestions, or that they also feel anxious and are using their spouse's complaints as an excuse to check something out that has also been worrying them. This information is useful to think about how I am going to start the role play. I want to sound encouraging that they have come in for the appointment and supportive for their vision difficulty. Check the healthcare condition the role play will be about from the background information, as well as any useful details which might relate to how the patient will respond to questions and options I suggest during the conversation. I can see that this patient suspects that they have a cataract in their right eye, and that my examination has confirmed this diagnosis. Read the tasks to check what needs to be discussed in the conversation. The verbs starting each task are really important in helping me to understand what I will say and how I will say it. Give findings means to explain your diagnosis and to ask the patient questions about what they know about their condition. Give information means to tell the patient more about what a cataract is. Explain means to tell the patient what the next steps are in terms of treatment. Reassure means to make the patient feel better about the option of surgery. Briefly outline means to tell the patient the basic details of what cataract surgery involves and whether the patient is happy to have this surgery. Lastly, run through this checklist. Is there anything unexpected to the patient in what I am going to tell them? The patient suspects that they have a cataract in this example, so this is not unexpected, but they may not know surgery is needed, so this should be introduced gently. Is there any medical language on the roll card I need to avoid because they won't understand it? Some of the language is quite technical, for example, slit lamp, crystalline lens, retina. So I should consider replacing this with lay terms or providing an explanation of this language if I do choose to use it. Which tasks do I need to spend most time on? From checking the tasks again, I feel that all of the tasks require a similar amount of time. Task 1 could probably be completed fairly quickly, but then I want to keep moving through the other one steadily, providing the necessary information and answering the patient's questions, but not introducing additional information or questions which aren't part of the tasks. The OET speaking test is unique in that it simulates the real-life conversations you have with your patients as an optometrist. It's important to remember this once the role play starts because it will help you to communicate naturally and effectively with the interlocutor as your patient. Here are a few tips to speaking clearly and demonstrating the assessment criteria. Get the role play off to a good start. You are expected to start the conversation as you would in real life. Make use of the information you picked out in the preparation time to start the role play appropriately for this situation. I know that at the point where the role play starts, I have already examined this patient and they have correctly self-diagnosed a cataract. So I want to confirm this and move on to asking the patient what they know about cataracts. So I choose to start, "Okay, Oscar, so my examination confirms your suspicion of a cataract in your right eye. I'm going to explain how we can treat it, but first, do you want to tell me what you know about cataracts?" This isn't the only way to start the conversation, but introductions wouldn't be appropriate for this scenario, so any alternative would be similar to this suggestion. Take time to listen to the patient and respond to what they tell you. The role card gives you a lot of information about the conversation, but you cannot know exactly what the patient will say in reply to your suggestions and advice, so make sure you are fully listening to what they tell you. Don't use this time to think about what you are going to say next, or you could miss something important. Show the patient you have listened by responding with something appropriate. For example, the patient might tell you that they are reluctant to have cataract surgery because they are worried it will permanently damage their vision. Show you have listened by commenting on what they have just said. Your reaction is completely understandable, Oscar, but cataract surgery is very successful these days and considered low risk. Be authentic in your role as an optometrist. Sometimes you will need to be firm and tell the patient that what they are asking is not good health advice, or at other times you will need to clearly explain a process the patient is unfamiliar with. Do what you need to and make sure you match the tone of your voice to what you are saying. In this task, you need to persuade the patient to have cataract surgery. To do this, make your voice sound kind and use reassuring language choices. If we do nothing, the cataract will get worse until you cannot see out of your right eye, so while surgery might not be your preference, it is going to save your sight. Remember that this situation is new to your patient. Many people are fortunate to have good health for most of their lives, and on the occasions they do need to seek medical support, they feel vulnerable and anxious because they do not know why they are feeling this way or how the problem might be resolved. Although you might have talked about cataracts many times before, this is new to the patient. Try to put yourself in the patient's shoes and think about what you would want to know about the condition if this was the first time you were discussing it. There are a number of ways you can practice the role play with a family member, a friend, or a colleague. It is important that you only look at the optometrist card before you practice so that you are only getting the same amount of information that you do in the test. If you print off the role cards, tear or fold the page in half so you only have your card, or if you are looking at the task online, change the size of the card so you can only see your part. Ask your patient to play their role fairly. If the task says they are worried, they should use language to show this. If it says they are frustrated, then similarly they should use language to show this. OET role players will never use extreme emotions like anger or tears, but it will help you prepare if you feel that slight pressure which comes from facing a patient who is feeling negative and trying to help them. Record the conversation on your phone so you can listen back to yourself afterwards. You can also use your phone as a timer to alert you when 5 minutes is complete. If you turn your phone face down in front of you, it will still be able to record while you will not be tempted to keep checking how much time is left, which is something you cannot do in the test. At the end of the role play, ask the friend or colleague who took the role of the patient how they felt during and after the conversation. Did they feel informed and supported during the conversation? Or was anything confusing, leaving them uncertain and with questions at the end? Consider this feedback and how you can improve on this for next time. Once you've practiced this role play, make sure you don't miss out on the extra ways you can use it to improve your English and prepare for OET. Here are 4 things you can do with any role play card to get the most value out of it. Assess your recording against the assessment criteria. The criteria are free to download from the OET website and contain both a description of the linguistic and communicative criteria you are assessed on, as well as the evidence of what the assessors are looking for to be able to score you at the different levels. Take each criterion in turn, read the evidence statement for each level, and critically decide which statement is the best match for your speaking in the recording. Practice the role play again with a different partner or by changing a small variable of the role play, for example by changing the patient's age or the emotion they are feeling about the situation. Think about the different language you might need to use for this role play if the patient was younger or had already had cataract surgery on their other eye. Or notice the questions and responses the different partner uses when repeating the role play with somebody else. Each patient is different, so although you are using the same cards, you need to be prepared to be flexible and communicate with this individual rather than preparing a set of phrases you hope to use each time. Use the role card as a basic outline for a writing task. Imagine you are referring this patient to the ophthalmologist who would perform the cataract surgery. Use the details in the patient card and your recording to explain the background to the situation and what has been discussed today. Request a surgical consultation and treatment. Search the internet for podcasts on cataracts or medical journal articles covering recent developments in the treatment of the condition to practice your skills for the reading and listening parts of the test. Candidates tell us that the preparation they do for the OET speaking test is immediately useful when they enter the English-speaking healthcare workplace and gives them the confidence that they can speak to any patient on any topic. For more videos and speaking test strategies to help you prepare, follow our social media channels on Facebook, YouTube and Instagram @OfficialOET and search the OET blog available on our website.